Hi everybody, it's me, Shannon. Looking a little cancer patient-y today. I can still get away with wearing a headband sometimes if I cover up the ick. So anyway, I thought I'd tell y'all about colon cancer surgery, which really is not so bad. After I got diagnosed, my surgeon and I scheduled a time and I did it as quickly as possible. I was diagnosed like on the 1st and I was in the hospital on the 12th to have my surgery. And they schedule it early. They try and do it mostly laparoscopically, which is really nice. I have a little, probably about a 3-inch incision along with, the little holes that they make to put the little laparoscopic things in. But anyway, so you go in for your, little pre-surgery thing. They put the IV in your arm. They give you the great top shelf margarita cocktail in your IV that is just the best thing in the world. And then they take you back. You get on the table. They push you under, and then you wake up. And I remembered waking up in the recovery room, but I was not in pain. But I knew that they had put a catheter in, which I was expecting, but I didn't know when they would take it out. But I did recognize the fact, having had a C-section before, I could recognize the fact that there was a catheter in me. So just know, some people, I think if you have your surgery later in the day, mine was first thing in the morning, crack of dawn. But I think if you have it later in the day, you're more likely to end up with the catheter when you go to your regular room, and then they'll take it out later. But since mine was so early, they ended up taking it out before I was put in my room. So I think the surgery was 2-3 hours, maybe. And then, they take you to just the regular hospital floor. You don't need to go to ICU or anything like that. They took out about 18 inches of my colon. And the surgery is very, it's not a difficult surgery. And they even tell you, there's a 1% chance that they might, nick your urethra or ureter or whatever it is, and they have to call in a urologist to fix that. There's a 1% chance something else not good would happen. I can't remember what that is. And then there's a 4% chance that you'll get what they call a leak. And a leak is when they're going, because I didn't have to have a ileostomy or a colostomy, so I didn't have to have the bag thing because my cancer was nowhere near my rectum. It was on the complete opposite side. So they were just putting together the two end pieces back together and sewing them up. So if it leaks though, and they say it leaks within 4 to 5 days. So generally you're still in the hospital if this happens. Then they have to rush you back to surgery. And that's when you're probably going to end up with a stoma and an ileostomy while you kind of heal, I think. So there is a 4% chance that it leaks. And they want to get that quickly, for infection and all that kind of stuff. But so there's only a 6% chance that something kind of goes wrong with this surgery. So it's not bad if you have to have a surgery. And none of that happened to me. I got up the first day I was there, and I was like, okay, I have to use the bathroom. How do I get up? And the nurse was like, okay, turn this way. And ladies, if you've ever had a C-section, that pain is something different. This was much easier. And I think it's because the incision they put on your stomach is vertical instead of horizontal. And it's a much smaller incision, but it didn't really hurt. So now I had learned from a couple of abdominal surgeries prior to this to make sure that I hit the pain medicine button, about a minute or two before I wanted to get up. So if there was going to be any pain, that was going to take care of it anyway, which I highly recommend. If you're going to get up, stand up, walk around somewhere, just hit the pain button first and then, wait a couple minutes and you'll be fine. So moving around was not difficult. My husband didn't stay in the hospital with me. He came home to like feed our dogs and our daughter and the cats and all that good stuff. So I was there overnight, and even overnight in the middle of the night, I was just kind of up because they come in all the time. So once I had gotten up, I was just like, forget it, I can walk the halls. So I walked the halls a couple of times that night, and everything was fine. I think I was in the hospital 5 days, including the day that I went in for the surgery. So, I mean, they do have you in there for a while. It's not a short time in the hospital. I don't know, maybe if I had had a smaller incision, I don't know. I could have gotten out earlier. I don't know. But I mean, I didn't have any pain and everything was healing well. And I mean, they even took the dressing off like the next day. I was amazed. I didn't want to look at it, but they took it off. One thing in the hospital that was new that I hadn't had on previous times that I had ever been in the hospital was every single morning when the nurse came in, it's usually like 7:30 because I think that's when their shift starts, they gave a shot of some sort of blood thinner in your stomach every single day. And I was not prepared for that because that had not been the case on any of my previous surgeries that I've ever had. But they said it was just like common practice now for everybody in the hospital. They got this. Now, for those of you who are like needle shy, since they did surgery on your stomach's still numb, so you don't feel the needle at all. So it wasn't until I think the last day I was there that I actually felt the needle go into my stomach at all. And tell them to do it closer to your belly button, as close to your belly button as possible. I don't know why, but for some reason, I guess the nerves are not as bad there or something. So the nurse was saying, yes, whenever your stomach kind of wakes up and you can feel pain, tell them to do it as close to your belly button as possible if I'm not your nurse. So that worked. It didn't hurt or anything. It was fine. So that was really colon surgery, and it was not bad. It was not nearly as bad as I thought it was going to be. I thought I was going to be in a lot of pain for recovery, and I wasn't. I was more just tired, especially when I got home. That was what I had the hardest time with. I also had the hardest time with eating, just because nothing really tastes very good anymore. And I think that's just cancer in general. So anyway, that's colon surgery in a nutshell, at least my colon surgery, and my surgeon was fabulous. I think it was 10 days later I went back to his office and he pulled out the staples, and I think about a week and a half later I called him up and asked if I could go back to work just half-time, and he let me, so that was nice. And that was it. So everybody, stay positive, stay strong, and I'll talk to you later.